So, okay, I think it's 5 minutes past 7. So we'll make a start. And I will let people in as they join because I can see them as they come in. So we've got all the panelists. So I'm Dr. Balu, I'm from London. We've got Dr. Asghar Alam is from Chennai, India, and Dr. Priyanka Mehta from Chennai, India. So welcome all, and we want you to be very participative in what we're trying to do here. So as I said, we will run through some slides just to refresh our memories on what's been happening, how important is brain health, and also share our experience and perspectives on this. And we would very much like you to contribute and join in at the end. And there'll be a lot of opportunity to ask questions, and you can also write into us. That's our website, and we will also send you our email IDs. So we'll make a start. We'll try and have so 15 to 20 minutes presentation for each of the panelists. So you will have 45 minutes, or thereabouts for the slides and presentation, and maybe have another 15-20 minutes for discussion. But you can always use the chat option to type your questions as you go along, and we will answer them either during the session, if we have time, or after that. So, so as I said, we have 3 panelists. Thank you all for participating. We'll just try and get this going. If I can get this started. That's a second. 1 second. It's always technology. Yeah. So Dr. Asghar Alam will go first. He's the CEO of Cerebri Healthcare, and is a consultant psychiatrist based in Chennai. And Dr. Priyanka Mehta is an obstetrician and gynecologist. She's based in Apollo Hospitals, Chennai. And I'm Dr. Balu. I'm based in London. So over to Dr. Asghar. I'll just unmute Dr. Asghar. Asghar, I don't know if we can hear you. Is your mic on? Just a second. Can you hear me, Asghar? No, can you hear me? Can you hear me, Asghar?
I can hear you. I don't think
we can't hear Asghar, right? We can't hear Asghar.
yeah.
Let me see. It's mute, unmute.
Is his device muted otherwise?
Maybe you can use the phone audio, Asghar.
Can you hear now, sir?
Yes.
Oh yeah. It's on. Yeah.
Yes, kind of checking out.
yeah. Technology, always. Yeah, it's always a glitch. Sorry about that. Yeah. Anyway, off you go. Yeah.
So I am Dr. Asghar Alam, I'm a consultant psychiatrist, and thank you, Dr. Balu, for the introduction. So I thought we would first go ahead with the crisis management of mental health issues during the coronavirus. Now, as we all are aware, a lot of things are coming in about coronavirus. So what are we going to do about it? Can I share the screen, or are you going to change the slides, sir?
Yeah.
Can I share the screen?
Yeah, I'm pressing it. Let's check 1 second. It's always technology, yeah. Yeah, go on. Yeah, this is the first slide, yeah?
Yeah.
Yeah.
So I hope we can just keep changing. Yeah. So let's first begin with the previous slide, sir. Let's first begin with our introduction. So what are the mental health issues that we are facing today? And I think a lot of you would have heard of come across, or a lot of people would have told about a lot of emotions ranging from fear, sadness, apprehension, irritability, frustration, insomnia, and in many instances, there are also reported panic attacks, which actually it includes a lot of palpitations, excessive fear. Some people have abdominal discomfort. They have their heart rate racing. So all those issues, they come and go as we keep hearing more and more about coronavirus news and its spread. Now, what are we going to do about it when we hear? That's the basic question that arises. Yeah. So what now? What do you think is going to happen now when we all hear about coronavirus? What do we do? So what is that everybody sitting at home can do, hearing about what are the deep aspects of coronavirus, like what is the structure of coronavirus, and how it's changing, how it's evolving, and so many things that we get to know. What are you going to do by taking in so much of information? And that's the problem that we are having here, because I strongly feel as a medical professional. Now, there are two kinds of informations which has been split by the World Health Organization. One is for the public and one is for the healthcare providers. Now here there's a lot of mix and match going on. A lot of people don't know the difference between the public and the healthcare information. So what they do, they're taking all the information that comes in, irrespective and irrelevant. And this is what we exactly need to know. By knowing so much, what are we going to do? What is the max that we are going to do? The max that we are going to do, the next, yeah, just wash hands. Yeah. So all we have to do is advised by the government. That's all. So if you do that, practice at home and just do what is being told, that is more than enough. How much information do you think you need? How much information you need to wash your hands or wear a mask or, to maintain social distance? I think we've been overflooded by a lot of information. So when we talk about management of mental health, so mental health is an aspect of health. Like health consists of both physical, mental, and social well-being, isn't it? So here we are going to talk about mental health, but we'll also cover the social aspect. But before that, let me tell you some basic information which I just want to brush up. The basic steps that we are told to manage in coronavirus. First things first is wash your hands with soap and sanitizers for at least 20 seconds or until the song plays of happy birthday or whatever. Then we are asked to wear a mask, where in India, it's compulsory to wear a mask if we step out of the house. It varies from region to region. And we are supposed to maintain at least 2 meters of distance or 6 feet distance, physical distance from others when we step out of the house. And most of all, stay inside and keeping it. So this is a basic management skills that are being taught by the government all over the world. Now coming to the mental health aspect. So coming to mental health aspect, there are so many things that can be spoken. Actually, this itself is a topic which needs a wide session. We can go along talking about it. So I wanted it to be more interactive. So I would be looking forward to the questions at the end of the session. Now, what are the ways in which everybody can handle the mental health? Like I mentioned, there's so many emotions that are going on with people, like anger, sadness, irritation, frustration. So what do we do? The first things first, when you read about the information from the government bodies, US or UK or World Health Organization, the first thing they tell you is restrict information overload. What is that supposed to mean? Meaning you're first supposed to know what you need to know. Simply put, just knowing about washing hands techniques and knowing about how to deal with stuff, that is more than enough. And restrict information overload also meaning social media information. We have been flooded left, right, and center with a lot of news, whether fake news, true news, and it needs to be checked and cross-checked. So it's very important that you just limit it. Just know what you need to know. That is all. And in a day, even if you need to know information, make sure you just have one proper medium, like go through a government website, or if you want to watch news channels, watch a proper news channel. I think that should be more than enough. Maintain a schedule. Now, what am I telling here when I tell you to maintain a schedule? Schedule can be varying according to person to person. That is why I have not mentioned what to do. So it's entirely up to you, meaning you establish something for your own self, according to your own needs, as per your own settings, right? I think if why are we sticking on to this schedule is because our life was busy. We were very much social being, and we were having a schedule. We were going to work. We had everything to do, and all of a sudden it's been taken away. We have been confined to a single place. Now, what do we do? Now, many people have lost their jobs. Many people are working from home, and many people have to go to workplaces with utmost precautions. Now, maintaining schedule is very important here, meaning when you are at home, you make sure you have your own routine temporarily for a fixed amount of time until the lockdown is over. Once this is over, it's easier to navigate from this schedule to your routine schedule, what you had before. You just you're awake the whole night, and you wake up the next day in the afternoon, and you just go about your work, and you don't know what to. All of a sudden, the lockdown is lifted, and you have to go to work. How difficult will that be? So it's easier to move from schedule to a routine life. Now, another important aspect I think Dr. Balu was also mentioning was we are trying to isolate a self. It's not it's just a physical isolation, and it's not a psychological isolation. So we need to stay in touch with them via the technological medium, although we need to have a social distance. So what does that supposed to mean? Now, one thing I would be glad this technology and the social media has got us is so close, and it's kind of useful right now because WhatsApp calls, Facebook, FaceTime, and all that, we can use that for our own good now. So maintain a routine, talk time with family and friends every single day. Make sure you speak to some person or the other so that you have some company with you. Why I recommend video call is when you look at someone and you speak, you get the sort of feeling of being together rather than just having a phone call or having a group chat or text messaging. This is just, just words and messages. And help others in a way, in any ways you can. Here we need to be very careful. There are government guidelines which we need to follow. And meanwhile, if you want to help, sometimes it might feature venturing out as well. So it is very important that you find a way to help. Like if you know someone you want to donate, we make a contribution, you can do that. And apart from that, anything else you need to help with, you can do that. I mean, biotechnologically, we have a lot of online NGOs working. You can help them via that as well. Maintaining balanced diet is also very important because when you're at home, you feel hungry, and when you're hungry, you start eating whatever you have in your shelf. So it's very important to maintain a diet plan, a routine. Like you are hungry and you want to eat, opt for some food. I think Dr. Balu will cover that next. So maintain a balanced diet. Limit screen time. Here, we overboard most of the time. So what happens is when we are using your phone or laptop, we tend to overuse at times. Now, at nights when you continue using, you might go beyond 1 o'clock, 2 o'clock, 3 o'clock, and then you end up not sleeping at night, and then you wake up later in the mornings. Again, when you wake up, again you're back to your screen. So this kind of gives you a headache. It starts giving you a headache. It starts creating visual problems. It starts making you more irritable and frustration. And so it's very important that you have a particular time set for each medium. Say, like you want to use a cell phone, have an app. Make sure you counter and you manage your screen time on the phone, manage your screen time on the TV. So all these are very important. Now, limiting or abstaining from the use of substances. Why I have mentioned here limit is a lot of people have been social drinkers. Now, what happens when you're at home, when you're lonely and you feel bored, you just try to drink or take substances just for the heck of it. Now, this is dangerous because that can lead to substance use disorders. Now, this is very important because if you can try to abstain, if you're a social drinker, it must be pretty manageable to maintain without the substances. Hence, it's very important you do not go overboard with the substances that you're using. learn new things. A lot of people have been telling new things. So it depends up to you. If you want to learn new things, it doesn't necessarily mean that you want to learn guitar or piano, or you want to learn how to play. It doesn't mean that. Learn new things in your own way. Like, for example, you are working with some project, learn something to use relevant to other projects, but make sure it is more relevant to what you do. And develop a hobby or bring back the old hobbies. A lot of people, I think you would agree that a lot of hobbies were lost in when the world was fast moving. We were all very busy. A lot of things that you used to like be ignored. I think it's time to get that back right now. Although staying indoors is very important. So I think we can create a hobby or old hobbies, like you like drawing or painting or dancing or listening to music, anything that comes to your mind. And very important aspect which I've kept for the last is mindfulness. Practice mindfulness and relaxation techniques. So next slide. Yeah. Now, what is the mindfulness that we're talking about? What exactly is a mindfulness? So here, what they recommend is you try to bring the focus to your present rather than being chaotic and ignoring all the feelings that you have about the past and the future. Just focus on the present. That is what mindfulness is about. Now, it doesn't necessarily mean that you need something to do for the mindfulness particularly. No, it's not necessary. You can do it via meditation. You can via your work. You can do gardening and in your house if you have gardens, and you can just start cooking something, helping chores. All that is a technique of mindfulness, meaning you are just living the present rather than focusing on the past and worrying about the future. Now, this is very important in managing the panic attack, as it has been mentioned in various journals recently, that mindfulness and relaxation techniques helps in overcoming the panic attacks. Now, what are the relaxation techniques that we are talking about? There are a lot of techniques like meditation, yoga, deep breathing exercises. I think we need to have a long session for that particularly. So we'll do that over the next period of webinars. And there are a lot more things that as it comes to your mind. Now, in conclusion, I want to tell you something. When we talk about mindfulness, relaxation, and schedule and routine, it doesn't necessarily mean you need to copy others. You need to do what others are doing, what others are telling you to do. Just pick something what you like and like what you do. I think this will be more easier because that's something you have. It is accessible and something that you like on your own. You need not do something just because someone else do it. So this is very important because that also works as a motivational factor, and it also keeps your focus and attention to the task. Now, don't overburden yourself with rumors and irrelevant information. Is actually a tagline of a lot of articles and a lot of government websites, if you can see. And the last thing I want to mention before I leave this presentation is do not stigmatize COVID-19, meaning we see a lot of places are being, I don't know, it's happening in India, evicted from their homes. People are stigmatizing the patients who are positive. They're starting to discommunicate with them, break the communication, not talking to them, staying away from them. Right, fine, I understand your fear, but it's very important you also give them support, lend help, because tomorrow if someone ends up having a COVID-19, God forbid, even they will need help. So it is very important that we write this COVID-19 with our own knowledge, with our own care, and be very humble and kind. I think that should get us over this this COVID-19. And in the end, I've just put up a slide for you. So if I want you to learn something from this webinar is first learn something about COVID-19, about yourself, adapt to the situation, to the lockdown, and even when the lockdown is over, and help. It is very important that we help each other. Thank you for listening. And if there is any further questions or any other recommendations that you have, feel free to ask at the end of this webinar. Thank you very much. And I would like to hand over the webinar to the next spokesperson. I think it's going to be Dr. Priyanka. Thank you.
Yeah, thank you.
So different time zones. So I will just start again. A pleasant day to one and all. Women and lockdown. So in this mental health starting about women in lockdown. So what is happening actually? I am Dr. Priyanka, and thanks all of you for joining. Today is Saturday because we are losing track of the days, and I hope I am audible also. So let me just start about, the next slide, please. Yeah, so women, they are different from men. And during any kind of pandemic or any kind of emergency, many times women are affected more than men are, because they have a different reaction or response to the kind of problems. They try to, they'll be thinking more about the future and how things are going to be. And they also have to be doing a lot of work-life balance. For many women is not over. It is in fact increased now. So that is the problem in these times. Next, please. And problem for women is that, see, now children are off from home, and they have not only you have to feed them, take care of them, they have to be entertained, they need to be schooled at home, you have to keep track of all kind of projects, you have to keep track of all kind of work that they're doing, because previously they used to be away in the school. That used to be the normal, where they're away either from morning 8 to 2 or 8 to 3, and then that's the time when mothers, even working mothers, would get some time, get ready to go to work, and homemakers would get time to be at home. But now you have to take care of the children. You have elderly at home who are at risk, and they also have to be attended with greater care. Next. And of course, we know in India, a lot of our families, because we are so dependent, we are working, and then we have somebody who comes to help us out. You have the maids, you have the drivers, you have gardeners, you have somebody who comes, your dhobi, who regularly comes to collect the clothes for the laundry and all sorts of things. And we have got so used to getting things delivered. And so it's like your whole life has turned upside down. The initial few days of the, next please. Initial few days of the lockdown, people were okay, let us, we had a clapping hands and all of those things happening, and we were kind of okay, we'll have a break, and people were cooking at home, and people were still the gravity of the situation had not sunk in. But now slowly, as the number of cases are increasing, and we are getting to know the reality, and lot of information on social media and all kind of information and bombardment of information, and you can, especially as the evening draws, I feel you have all these reports, and you have these a number of fatalities and all, and so the whole thing overburdens a woman so much, and she starts thinking of, okay, this is the end of the world, already I'm burdened, and I have to, not only do I have to do all my domestic work, also it is because working women now have to work from home also, they have to plan a lot of things, so it is definitely going to increase a lot of stress and a lot of mental issues in women in days to come. Next. So emotional well-being is really affected. Women are feeling that they're feeling very moody most of the time. Sometimes they're feeling so locked in. If they are a nuclear family, they feel there is no help, they have to do everything on their own. Sometimes in a joint family, they have to again take care of everybody. So that's kind of, and they always had this idea that the Western world, and they used to dream of going to all these cities. And now when they see that all these cities, they were dreaming of going to Paris or New York and Italy, all these cities are in a mess. So the idea of a holiday sometimes there, all of these things are now, it's like their dreams are coming to a shattering end. And these are also causing kind of haunting feelings coming for the women. And usually women, whether it is the budget of the house, they are kind of the CEOs of their households, and they like to be in control of the situation. Many women start their day with a morning walk and then their morning coffee, and then they feel okay, they're ready for the day, or they have a cook coming in who helps them, and they want things to be very perfect. And in terms of when they're going out for work, or even if they are at home, they enjoy their trips with friends. So it's like everything is over for them, right? And they're losing their very important me time, where they're not able to, like, even someone I knew was sending a message that it seems that even God is angry with all of us. It's the first time, I think, in anybody's and all of us lifetime that temples and worship places are closed, and that too for such a long time. People here pray to their gods and goddesses with flowers every day. So many women, that is a routine for them in the evening to get flowers. Somebody will come. So all that which is part of routine for like as long as they were from children. This used to be happening, and now suddenly all that is over. So it's a kind of gloom and doom feeling that women are getting. Next. And also the daily routine. So there seems to be no end. They wake up in the morning. For most of us, we are doing all the things which we had somebody come to help us. So you start your day, you cannot, even if you are sleeping off late because of this lack of routine, you have to be up early morning to clean the entire house, cook food for the family, 3 proper meals, because everybody is hungry all the time. And kids are also either having online classes and you're worried about that. One point of time, mothers were telling the children to be off the screen, but now schools and colleges are conducting most of their classes online. So, and there seems to be no end to this. Similarly, you have a lot of restriction. You keep getting all these news about the virus getting, people who are working in the vegetable markets getting infection. So then women are getting scared. Okay, what do I order? And the moment they're actually short of OCD, because I can even speak for myself. The moment some food or some other vegetable is brought from outside, you just have you display it off. You're cleaning it with all kind of information is there to clean with vinegar, clean with salt, and then you want to clean it, you want to dry it, keep it. So the work has increased by manifold. And then you're like, you know, you also have to make sure that everybody is washing their hands. It is simple to say, my previous speaker told us it's as simple as washing hands, but I was in fact doing an experiment in my house also, making everybody wash hands, because they're like, why do you want us to wash our hands for such a long time, 20 seconds, singing that whole song? I mean, sometimes it just doesn't happen. And not only you're washing hands, then your hands become dry. So you have to remind everyone to apply some cream, because if you don't apply that, then again, there's chance of the virus entering into your hand. So it's like never ending task going on and on. But then I think women always find their way out. And but the good point about this thing is that now a lot of women have been the gatekeepers of health and nutrition. As I was going through during all kind of pandemics and epidemics, women have learned during the World War, whatever minimum is available, women are able to take care of that, and they're able to kind of make the best for their family. And also now they are taking care of the health, because previously it was used to be just rush. No one has a time to sit and eat at one point of time. So now everybody is meeting together, sitting, having healthy food. So there are certain good points also which are happening in this lockdown. Another important issue is about unplanned pregnancy. So a lot of calls as a gynecologist where people are either they have not expected and they have unplanned pregnancy, and there are lack of contraceptive options, because some have been planning a pregnancy but not now, and they suddenly find themselves pregnant. So they have a fear that with this viral infection, is it safe to continue pregnancy? How will I get my ultrasound done? How will I get my checkup done? And when it's an unplanned pregnancy, sometimes they are not in the able to continue pregnancy. Then again, it's like a shock, and that itself can bring a lot of repercussion and a lot of problems in the family. So of course there are options, and that whole fear is there that there'll be no healthcare anywhere, all hospitals are closed. So that itself is a big fear now in women when they get to see that they are pregnant. But not to fear, there are options, and when they get the appointment, further they can decide what they have to do. So there is a way out. So the message out is that even if it's an unplanned pregnancy, there is a plan to help. Next, please. Yeah, next. Financial disruption. So again, women are sometimes, they are the ones who make the budget for the entire family. And then you have all these things. You have their loans, you have the card loans are there, or sometimes they may not be thinking that they need insurance. Okay, their husband is taking care of all the insurance. So they're like, you know, and then suddenly you hear all this news about the COVID and number of deaths happening. And then you wonder what will happen. Suppose I get the infection. Especially you have healthcare workers. I have known many doctors who are going into the front line, or whenever, you know, you are going, you're seeing some patients, the whole trajectory of emotions and feelings just keep going on and on, that, okay, what if I get the infection? What if I get hospitalized? Who will pay my bills? What if something happens to me? Who will take care? So all kind of things happen. And sometimes all our help that used to come and help us, you know, now you're not calling them with the lockdown. Nobody's coming home. there are people who are financially dependent on you. You could be running a small business and you have to pay for your those people, and then how long are you going to be able to pay for them? And then these are a lot of things which, you know, you just have to, things which were just taken for granted previously, because, you know, life was just going on as one fast paced train, have now suddenly got disrupted. But then, of course, there are solutions also. All is not gloomy, because now I think we are not going out. So we are not doing a lot of binge shopping, a lot of unwanted purchases. In fact, the debits are happening only when you have to pay somebody or you have to go out for some basic grocery. Otherwise, your account is just, you know, so we are spending wisely, and that is the order of the day, I guess. And because you're not using your vehicle, you're not spending at all on any kind of petrol. And then that's a lot of eating out used to happen holidays. So in all of this, I think what you have to remember is, like Dr. Asgar also said, that whatever little help you can do, sometimes you are not able to go out and actually help people, but then you must be knowing people who are dependent on you. So it's easy nowadays to, you know, being women, you know, you feel compassionate about all those people who are dependent on you, and you can just help them and offer them some kind of financial assistance, and that will go a long way. So too much to do, no end to chores. What can I do about it? Next. Yeah. So now that we have a lot of time, we always keep postponing a lot of paperwork, bank work, all the files are in a mess. So I think it's a time that you can just categorize everything, have a structure to all your files. If you're having some kind of a little bit of financial advice, what I got from my banker was that you could just have some liquidity around, and you can probably stop your certain kind of investments which were going on, and then your bank and all details, you can update on all of that. Yeah, next please. Yeah, and of course we have more quality time, because I don't think we would have ever got so much time at home with our loved ones, and something good will always come out of all the worst of situations. And if you don't see positive created, learn to accept what is a new normal. We have to now go to the next phase of beating about and panicking and ranting that all of this has happened. Accept it. Okay, this has happened. It is helping the environment. The ozone layer is getting replaced, where the Ganga water is getting clear. Environment, you're seeing the Himalayas from almost 600 kilometers away, and a lot of good things are also happening. And then you can also, like you said, you know, just sit and maybe not learn. If you're not able to learn a new skill, fine. Cooking is something everybody is doing. So even the reluctant people who wouldn't cook have started doing that. And we have to try and move forward from what this is and be in the new normal. And like I told you, this is what I found on the WHO website. Almost 1,20,000 people have recovered from the illness. So that's a very good news. And also your CO2 emissions, pollution level are really coming down. And I think as adults, sometimes we have to behave not like 7-year-olds and just crying about the whole thing. And I think we should get inspiration from the children they are the ones who have to start living their lives, but they are so positive and they are so, you know, eagerly awaiting. Kids are awaiting going to school. When you tell them, okay, maybe the new school would be where you may not be able to mingle with your friends as freely. They're like, no, I don't think that kind of a school we will accept. So we'll have to see and watch what happens in the future. Next. And this is the important thing, is we all be in this together, and not to feel alone, but just stay connected. Find out someone with whom you could just talk and, you know, just just board off and just tell off all that you're feeling, so that you don't get overwhelmed with the situation. Next. And of course, staying positive doesn't mean that you are happy all the time. There will be times that you will be feeling sad and bad, and then you have to find ways to reach out, and definitely better days are coming. Next. So I'm really hoping that I'm not able to tell whether how many months or how long it is going to take, but we are going to do it together, and we are going to come out of this very soon. And just ending my talk with this forward I got today. Maybe you need to increase the volume on your So this is the truth which we have to understand. So our pages, lot of pages are still empty. Let us fill it with smiles and enjoy our beautiful life. Even though it can suddenly make us feel that this whole life of ours has changed. We may never have the normal that we used to, but probably that normal was not the correct normal, and the normal that we're going to move forward to probably would be, people will be more conscious maybe of the environment, and we will reduce our needs, and we will also learn to appreciate and not take anything for granted. So thanks a lot for joining. So any questions would be happy to answer in the end after Dr. Balu's talk.
Yeah. So yeah, I think we're still okay on time, and I'll try and keep it brief as I can, when we'll give enough time for questions. Just a second. So tough times don't last, tough people do. So now we're just going to look at something very specific, and I know Dr. Asgar and Dr. Priyanka has talked a lot about, how to keep yourself safe and look ahead. And in this series, we'll be covering more of those things in detail, as they mentioned. But I thought, it's important that we look at something very specific when we don't have any a real treatment or cure. How do we then protect ourselves? So did you know that having a mental health condition, such as anxiety, depression, weakens the immune system and decreases your ability to fight off illness and makes you more vulnerable to common cold, flu, and other viruses. So other viruses will include the coronavirus. So this is why it's very important that we look after our sort of brain health and mental health, as we call it, in addition to our physical health. So the mental health is very important. Any problems there will weaken the immune system. So there is a subspecialty, in neurology called neuroimmunology. It's a study of how our nervous system, the brain and the nerves, interact with the immune system. The immune system, as we all know, is helpful in fighting off any infection. Now we know that there is a direct link between the immune system and the brain through the lymph vessels. The lymph vessels carry lymph fluid, which is a part of the immune system. This is kind of studied very extensively now. Lot of interest in this area to see new treatment methods can be attempted, modifying the immune system. So it is a very important area that's coming up. This is very new. And there is also a growing interest in what we call a psychoneuroimmunology. That's looking at the relationship between the nervous system, as we know it, the brain, which causes anxiety, depression, insomnia, sleeplessness, as many of us will know. And your endocrine system, the hormones, thyroid, a lot of us know about the thyroid. The adrenaline gland is implicated in stress. The reproductive, functions are moderated by the secretions from the gonadal endocrine system. And then we have the immune system, which fights infection. So there is definitely a connection between the brain and your ability to fight infection. Many of us know about depression, and I don't want to go into too much of a details. I mean, there may be medical professionals in the audience, so I just put up a slide to capture some of the mechanisms underlying the depression, connection between depression and an immune system. Um, we know now that aging, heart diseases, bone density related issues, bone pains, arthritis, diabetes, certain type of cancers um, can be associated with mental health issues. You may have heard about cytokine storm. Those of you who've been following what's been happening in the medical world about the complications of coronavirus will be hearing a lot about this. It is believed that the coronavirus affects the lungs, and it also interferes a lot with the immune system. What we know is that depression can downregulate the cellular immune response, so which can then lead to prolonged infection and delayed wound healing if you get an infection. This is again an area that's been extensively studied. When you look at the connection between stress and immunity, as we know, anxiety and stress can trigger the fight or flight response, which increases the cortisol level, and that would have an impact adversely on the immune system responses. So there are several things that could harm our immune system. So stress and anxiety, very important to understand that it does affect our immune system. For those of you who drink alcohol to manage stress or to sleep, that could have an effect. And it's important to have good sleep, eat well, drink enough water, exercise, and not smoke. This is for completion sake, I would just put it in, some people who we see have what we call as bipolar affective disorder, where people can have extremes of a mood. And even in bipolar disorder, you have um, a number of mechanisms which kind of impact on the immune system and causes the dysfunction immune system. In the following sessions, we may be able to look at some of these conditions in detail and what you should do if you have some of these conditions. In the absence of a clear treatment for the virus, it's very important to make sure that we are well prepared, for the virus. And we also know that, up to 90% of patients who have the infection probably don't develop a very severe form of disease or complications. So many of them are asymptomatic, and some of them have fever and the symptoms that you normally have been told about, cough and temperature, and body ache, and sometimes loss of smell and taste, but they don't develop the pulmonary, the lung, or the breathing difficulties that's very few people suffer with. So but now we know that having a mental health problem definitely does have an adverse impact on the immunity. I'll just give you some tips to boost immunity. And as I say, this is a very, very broad overview. It's very, very important to drink enough water. We know 80% of our brain is water. So we need to drink at least 2 to 3 liters of water a day. That roughly translate to 10 to 12 cups a day. The challenge most people face during lockdown is they are at home and they're not out and about. They may not sweat a lot and hence may not feel that thirsty, but it's still very important to maintain that level of fluid intake and hydration. So keep a cup near you, if you're working from home, have a bottle, make sure that you kind of drink. You can also drink other things, like teas, chamomile tea, ginger tea, lemon. What some people also advise is don't drink your calories. What they mean is don't drink a lot of sugary drinks or juices always. Don't go for milkshakes or sugary drinks always. You can have one or two during the day, but make sure that you have a lot of water. Clearly no to alcohol or drugs. there is increased tendency to drink, to get rid of some of the emotions attached with this, but definitely that's a no-no. So after eating, make sleep your priority. Practice sleep hygiene techniques. Very important, to have a routine, as Dr. Asgar mentioned, and as Dr. Priyanka mentioned. There's no point in losing sleep over things that you don't have much control over. So let your sleep be your priority. Aim for 7 to 9 hours of sleep. And even if you, in the past, haven't had a chance to catch up on sleep because of commuting, working late, now it's a perfect opportunity to catch some good sleep. Make sure that your sleep is restful and refreshing. That's very, very important to experience, so that the body recharges, and that actually happens the immune system. In terms of food, food and immunity can be a separate session. It's a long session. There's a lot of people have talked a lot about what type of food. But what I would say is there is a tendency to eat a lot of snacks, particularly when you're at home not doing much, and the people visit their fridges often, go into the kitchen, what can I cook, and children asking their parents or mom, what's for dinner, what's for snack, and can we make this, can we make that, because we associate all types of emotions with food. But it's very important to make sure that we look after what we eat. So probiotics, milk, and yogurt, if we can get that, it's very important. There is some evidence to show that mushrooms are very useful to boost immunity. There is a lot of studies looking at certain substances within mushrooms, which helps immunity. And I put this slide here with this picture, and it's called the kind of a rainbow color diet. Make sure that you have sort of variety of colors in your diet. So that could be your common, vegetables and fruits that you can identify in the red, yellow, green. So I think you all know this. You make a good selection. And again, going back to what we know from our traditional sort of way of medicine, garlic and ginger has several immune boosting properties. And in addition to this, I've been reading a lot about some of the medicines coming from Ayurveda or Siddha background, and they seem to have some effect, antipyretic, anti-inflammatory, and some immune boosting effects. But you need to be mindful that some of these things have to be taken over a period of time to have their effect. So when you take them, you shouldn't take them just as medicine, as one dose or two doses. Make it a part of your lifestyle, and keep following this, so that your body really absorbs and benefits from this. Vitamin D has been talked about a lot in helping your mood and immunity. Vitamin D, as we know, is got easily from going out in the sun. I guess with the lockdown, many of us are not going out in the sun. You can consider vitamin D supplements, but some of these food are rich in vitamins. I know there is a bit of an issue in getting fish and meat, during this lockdown, but try and eat as much as you can, eggs, milk, and many times you get fortified beverages and cereals with vitamin D. So make sure that you are aware of vitamin D deficiencies that can happen. Another important thing is zinc. So you look at spinach, kirai, நம்ம ஊர்ல kirai, we get that a lot. Nuts are very good. Pumpkin seeds, cashew nuts, dark chocolate. Again, fish, some chicken. So they're all good for zinc as well. And if you're not able to get many of these things, do consider zinc supplements. This is another big thing. Exercise outdoor is going to be a challenge in a big way. but you have the opportunity to walk within your house, go up and down the stairs, walk in the compound. So I would say most of us can go for at least 30 minutes of moderate activity, 5 days a week. So half an hour of gentle activity. If you are used to high intensity muscle strengthening activity, then you can still do it. Those of you who are pro at it, but most of the people would follow a 30-minute routine. Just that could be a walk, going up and down the stairs, some stretching exercises, so that would be very useful for immunity as well. So make sure that you eat well, sleep well, exercise well. There's nothing much you can do while you wait for this to be over in some ways, and we might get to a new normal. But what you need to realize is your mental health does have a huge bearing on your ability to fight the virus. So this is mostly from a biological point of view, and we need to do everything that we can to improve our mental health, which would in turn improve our immunity, which will then improve our chances of not getting complications of this virus. So I leave it at that. I think we have 9 questions. So we will just go through them, and I'll sort of unmute everyone. I've finished, so I'll unmute everyone 1 second. So you can, if you can unmute yourself, and that's fine too. Let's unmute everyone, whoever wants to unmute.
Sukhi side hai dekh Sukhi. முடிஞ்சுமா 5 minutes ma.
So that's, yeah, please unmute yourself and ask your questions here. So positive things, resist change, finally adapted. Yeah, Sailaja. Yeah, if you want to say, anyone who wants to say anything, please unmute yourself now. We can have a discussion. That's fine. So we resist change. That's always an issue. You're absolutely right. And we adapt it. And also, we will talk a lot about what we call as a COVID grief, COVID insomnia, very specific to this scenario. So it's very important to be able to recognize this. So how much tea can you drink in a day? How do you keep a routine? I wouldn't expect people to drink more tea than they would normally drink. I know when people are bored, they would have coffee or tea, but you need to be very careful that you don't consume. I know coming from India, I know our tea has a lot of milk and sugar, and one needs to be very careful about it. But if you're just drinking, tea as in having some leaves with warm water, yeah, I think that should be fine. Make sure that you don't overload yourself, because some types of tea can cause diarrhea, but I don't think you can poison yourself with tea, but it's a stimulant though. So that's very important. Yeah. And yeah, please, type in your routine. Yeah. And someone says, it's 11 p.m. to 6 p.m. sleep, at least an hour of exercise. I think women may not have this luxury. And women should be given this luxury, is what I would say. It's very important that men and women, have, this should never be a luxury. It's a necessity, and maybe men can do, some of the work now, so that's going to be the norm going forward. And immunity boosting food, yeah, a rainbow food, yeah, that's a good concept. And as a part of the webinar series, if you could do a session on finding on purpose associated with meaning the current experience, it would help others handle. Yeah, so we have that. I think that's a very good suggestion. In fact, I know we all know each other, and we've worked closely together. And in fact, we were even planning to invite people from other industries, who may not be in health, but who have a deep understanding of finance, economics, philosophy, to come along, probably in the later series to look into this in great depth. There is a chap called Johan Hari. Some of you may have read his book called Sapiens. He's a historian, and he has been talking about this in a very interesting way, and that's worth listening to, and we'll also bring some perspective. But what I would very much like to also hear is your perspective on how you cope with it. As I say, this is about more about learning. It's not about us as just experts telling you what to do. We have experience in dealing with this in different parts of the world, and we get to hear about this all the time as a part of our work. So we are very happy to share some of that. But you guys are in it, so you're also experts in your own condition and how it affects you, how you found solutions to some of the challenges that you face. Yeah.
I think there are two
Uh,
more.
yeah, that's what I'm just looking at the next two more. Talk about fear of developing any permanent damage to body or unknown underlying issue that surfaces after recovered from this virus, and how to test, identify, and treat it. We will come to that. I think we'll make a note of it. That's a very important question, because from a lung point of view, I've seen some people developing fibrosis, and there's some pathology. I can share. I don't know if Priyanka and Asgar have experience of people post-COVID. I've seen, one or two cases post-COVID, and they've developed a post-traumatic stress disorder. One chap, he's been out for about a month. He's recovering well, but very healthy person, and so he did have a very severe post-traumatic stress. Having nightmares about his time in the ICU. When you look at the Royal Colleges here, the part of the college, the part of what they do is also ask us to report any sequelae, mental health sequelae, brain health sequelae of COVID. So this is a very new area, and as we know it, things are developing. But watch this space. If there is anything that comes our way, we will certainly let you know. And also, everyone who is here, and for people who just subscribe to us. Just give your emails. We'll not abuse it. We'll just put it in our database, and also send you any new information that you have. And feel free to reach out to us if you have any specific questions. Doctors can consult you as well. Socioeconomic pressure of losing jobs, being sent home, for those who are abroad, affecting the mind in turn. Yeah, that's a very, very important question. And we will, I think, have a financial consultant also, who will come and talk to us about these things, because it is very important to recognize that. Why? Because the world might be slightly different, and also there may be new businesses that are coming. So if you are in touch with us, just write to us. There are webinars happening on those areas, and there was a webinar today I attended, which was very specific to people who are abroad and who might want to return back and do something different. Because all over the world, people who have left India as economic migrants may not have the same economic opportunity which took them to that new place, in the past. So things would have changed, and the new country or the employer might say that they don't have a job for the skill set that they have. So it's about learning, adapting, and changing as well. So it is about us, and how we grow out of this. So that's important. That's a very, very valid question. Thank you. Too much washing hands, spending too much time. No, that is another important issue. Because we should be mindful that our anxieties don't get in the way of us responding to some of these virus related worries. It is very important to recognize that there are some people who suffer from a condition called obsessive compulsive disorder. So there will be a fear of dirt or contamination, usually, and now their fear has been confirmed. In the past, others would have ridiculed them. Others would have said, no, this is nothing to be worried about. You're overdoing things. But now they've got some confirmation that the world around them and around us is infected. And washing shouldn't just be a way of comfort. It should be a methodical process, just to make sure that you one second, just to make sure that you are safe and clean, and not just to wash excessively to allay your fears. So if this act of washing hands is associated with some emotions, you need to be careful. Yeah, if you are less fearful and less anxious because you're washing, then you need to think again and stick to the 20-second if you can. Do it very methodically. Yeah.
Yeah. Yeah. I think it's
Yeah. So
right.
Asghar may say something. Yeah. Yeah.
I would like to add on for the washing hands.
Yeah.
There is no guideline to tell that how much you should wash your hands. It's speculated that you need to wash regularly, routinely. So I would feel, see, when you are locked in, when you are at home, you are secure, everything is in your place. Now, why do you need to keep washing your hands when everything is there inside?
Yeah.
Wash
No,
your
that's a
hands.
good point. Yeah.
When you go out and come to wash hands, that's fair enough. Why do you need to keep washing when you are at home? See,
Yeah.
these guidelines have not been clarified by either WHO or the CDC.
But
That's
the
very true.
thing is, I also would just like to add, like, sometimes we have seniors, elders at home. Now that this infection is not going to spare anyone, so there is no young and you're not secured. But especially you are not in the habit, like you go out, you buy something, and then and then we don't every time previously would clean the whatever you have got, or immediately clean it, or so we don't know. So that's the whole reason why we are just getting into the habit. But too much washing hands also is not good, because your hands become so dry, and then you're actually if you get infected, then that is going to make your skin more dry, and that means you're more chance of getting infection. But it's just that the whole method of teaching how to, this is how we do a surgical scrub when we scrub for surgical cases. But just to bring that whole concept, but too much of hand washing also may not be a good idea. So
Yeah, that's true.
from
And
outside or getting stuff from outside, you wash your hands.
yeah,
thoroughly.
and also someone, someone is asking, washing hand is okay. Is it necessary that you have a bath every time you go out? Well, depends on what type of activity that you have done outside. So obviously, if you're a medic, you're a doctor, or if you're a frontline worker, a police officer coming into contact with so many people, then obviously there is a high chance that you will have the virus on your body. But if you've just gone out very quickly to get something and you're back, then probably you need to use your discretion, mainly, like we said. But another problem is in a place like Chennai, where there is a water scarcity. I don't know if it is advisable just to use a lot of water as well. We need to be sensible in some ways. But mainly be as aware as you can and be as clean as you possibly can. I think that's what we would advise.
Yeah, I think you can time your bathing to going out, because most of the schools in India are open from 6 to 1. So it is very advisable that you buy all the things, come back and have the shower for the day, rather than have a shower, go out, then come back, then have a shower.
Yeah, like they're also telling water should be at 60 degrees. I mean, you shouldn't burn yourself.
Yeah,
That's also important.
I think it's very important. So all this that comes to your mind.
That's very true. Very true. Very true.
Someone has also asked about donor, like if you want to donate blood after being COVID positive, then how can you donate? So yeah, probably the virus shedding is, they say it's up to 37 days to 40 days. In fact, today, the Royal College of Obstetrician Gynecologists in London, their president also, like, it's become, I think the more number of people are getting infected abroad. So even he and his entire family has got infected. So he was sending out a newsletter that he's just had his brush with the virus, and then and now they are planning to test even the stool examination, the next phase for pregnant mothers, to find if they're infective or not. But then it stays for almost 37 to 40 days. So after that, I think once your negative testing is negative, then you're as good as anyone else.
Absolutely. People are donating plasma for plasma.
Yeah.
People are being plasma donors for COVID-19. So I think once they develop antibodies, all this fear of blood donation and getting in, it's all okay. I think it's not like an HIV where once you have the antibodies, it's there for the rest of your life. It doesn't last like that. So as far as we know for now, but we don't know how things will change in the future. So we have to wait and watch.
And we have another question. There isn't protocols at most part where there isn't a negative test being performed to confirm virus out of the body. How do we know we are safe and not a carrier anymore? And how long one has to wait for normal personal relations, physical contact, and handling children? So like I said, 37 to 40 days, that's the maximum they have found feces transmission. So probably like in India, actually, they are not discharging patients. They are, anyone who is positive is being kept as an inpatient in the hospital. Maybe that will change as numbers increase, but they are discharging only after 3 tests are negative. So once 3 tests are negative for the virus, that means you're not a carrier anymore. And then you can, that means you don't have the active virus, you have the antibodies. So after that, it should be fine. So it does take around 6 weeks from the starting of infection, and then you're non-infected. But then still, I like Dr. Asghar said, this is a very new virus, new infection, and all guidance, whatever is there, is a living document. Every day we have new updates coming in. So for now, 5 to 6 weeks is a good time.
Yeah. Thanks, Anna. Thank you, Anna. Yeah, no, that's very useful. And we would love to hear from you at some point as well. Just write to us. Maybe we will have you on a session. You know, Anna is a very, very good friend and a colleague. She's a very experienced doctor from London, and she's working in Qatar. So yeah, time for iftar. Yeah. Thank you, Anna, for coming.
Got done with mine. Yeah, I think.
Yeah, and it'll be time for your iftar as well,
No, I'm
Asghar.
done. I'm done. Ours is 6.
Oh, yeah, 6. Okay, yeah,
I finished
6:30.
and then I came.
You've finished that. Okay, okay. Wonderful. Yeah, no, it's very good. You know, I think we will end it here, and we will
I
get
finished
more people
making
to.
dinner also. So that's how we are planning now, living around
Eh,
COVID. New
Exactly,
normal.
because
Yeah.
I'm yeah. So no, thank you all for coming, and we'll have I'll send more emails about the next sessions, and we'll keep informed. It's very good. We've got many interesting questions, and people are emailing us as well. And sadly, many people couldn't join us. There were many registrants, much more than what people could join, and they're all looking forward to the video. So I said, I will share it with them. So yeah, no, this is very good, and thank you, Asghar and Priyanka, for taking the time, and we will do more and more, and hopefully we'll get more people engaged. Yeah, thank you very much.
Thanks so much.
Thank you.
Thank you.
Yeah.